Technical Veterinary Learning. The founder and producer is Professor Ahmed Mamdouh El-Sherif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-vice dean of Faculty of Veterinary Medicine, Bani Suef University. We will speak today about an important infectious diseases of sheep and large ruminant has the name of Campylobacteriosis. This disease, known previously as viprosis or epidemic abortion. Bovine genital Campylobacteriosis is a venereal disease of ruminants characterized primarily by early embryonic death, infertility, protracted birthing season, and occasionally abortion, with probably worldwide distribution. Epidemiology of Campylobacteriosis. Pathogenic risk factor is one of the most important epidemiological patterns of this disease. The pathogenic risk factor of Campylobacteriosis are Campylobacter species infection. Campylobacter species are gram-negative, non-spore former, motile, curved or spiral, poral flagellated, microphilic bacteria. By means it needs a low percentage of oxygen for growth in either tissue or in the lab. This is the shape of Campylobacter bacteria under microscope, are gram-negative. The shape under microscope are gram-negative, non-spore former, bacilli. This is the shape of Campylobacter species under microscope. Flagellated, polar, and motile is one of the characteristics of Campylobacter species. And this is the 3D shape under microscope. Sheep Campylobacter species are Campylobacter fetus subspecies intestinalis. The cattle Campylobacter species are Campylobacter fetus subspecies venerealis, Campylobacter fetus intermedius, Campylobacter fetus subspecies intestinalis. All of them are microphilic by mean grow in atmosphere of 6% of oxygen, 10% of carbon dioxide, and 84% of hydrogen or nitrogen. It is susceptible to all adverse conditions such as heat, dryness, and light. It is live well in the soil, manure, and dry food staff. Campylobacteriosis occurrence is a worldwide distribution in every country in the world and recorded. Campylobacteriosis susceptibility. All large and small ruminants are susceptible to infection by Campylobacteriosis species. Younger animals appear to be at greater risk in comparison to older animals. Later phenomena has been attributed to a higher stocking densities. Sources of infection. Sources of infections. Number 1 for males: the prepuce, distal part of urethra, glans penis mucous membrane, semen, and intestine. Sources of infections for females are vagina, cervix, oviducts, placenta and aborted materials, intestine, and gallbladder. Sources of the infections. Number 3 is the artificial insemination centers, the contaminated apparatus for semen collection. Transmission of Campylobacteriosis. In case of sheep, the main route for transmission is the oral fecal route. In case of cattle, Campylobacteriosis transmitted through venereal route, coitus between infected male and or female and vice versa. Number 3, male and female by contaminated apparatuses through artificial insemination centers. Number 4, infected animals introduced to non-infected farm. Pathogenesis of Campylobacteriosis in case of cattle. Pathogenesis of Campylobacteriosis in case of cattle occur through the following procedures: contaminated semen and or contaminated apparatuses by Campylobacter species lead to carry the microorganism to the cervix, which reach to the uterus and persisted in the reproductive tissue of the cattle, either for infection for new male during coitus or infection to new apparatus in case of artificial insemination process. When the uterus becomes gravid, the Campylobacter species enter and cause placentitis and cotyledon separation from caruncles. This will lead to fetal blood infection and post-infection by 7 to 25 days up to 3 to 5 months of gestation period. Abortion will occurring with damaged, dead, or weakened fetuses will be noted post-abortion. Pathogenesis of Campylobacter species in case of sheep. Pathogenesis of Campylobacter species in case of sheep occur through the following process: contaminated food and water by Campylobacter species will drive the microorganism to the digestive tract, making penetration to the mucosa and reach to the blood, cause bacteremia. When it become, or in case of pregnancy, it will go into gravid uterus, making placentomes infection, and then invasion of the microorganism to the fetal blood, cause abortion and damaged, dead or weakened fetuses, as well as some ewes die from retained dead fetus and peritonitis. Some organisms localized in the gallbladder and produce carrier species female. Diagnosis of Campylobacteriosis. Diagnosis of Campylobacteriosis diagnosed through generally by epidemiology and then by clinical symptoms. Clinical symptoms in case of cattle will be inflammation of the whole reproductive system post-infection, female repeated breeders syndrome, And number 3, second trimester abortion between 4 to 7 months. Number 5, males shows no clinical symptoms. Clinical symptoms in case of sheep: number 1, late abortion. Number 2, abortion with damaged, dead, or weakened fetuses. Number 3, mild placentitis with oedematous intracotyledonary area and hemorrhagic cotyledons. Clinical symptoms of sheep also: post-infection by 7 to 25 days up to 3 to 5 months of gestation. Abortion will occur with damaged, dead, or weakened fetuses will be noted. Abortion storms can occur 2 to 3 weeks following to the first sporadic abortion, and incidence is typically to be 10 to 20%, but in outbreaks can be as high as 50%. Use infected at 105 days had 100% of abortion rate, but use infected at 126 days from the gestation period had only a 20% of abortion rate, reflecting the immune competence of the fetus gestation period. This diagram explains the cotyledonary placental structures, which is convex in case of cattle and concave in case of sheep. The cotyledon or chorion thick mushroom-like with crunkle in the center of the endometrium, while in case of sheep it is a concave like crescent with crunkle found at the border of the cotyledon area. Laboratory diagnosis of Campylobacteriosis. For making correct laboratory diagnosis of any disease, you have to correct the samples from the diseased and environment of the animal. The samples in case of Campylobacteriosis are vaginal mucus during estrous cycle, vaginal mucus during intraheat period, uterine discharge post-abortion, fetal membranes, parenchymatous organs, liver, lung, kidney, heart, and brain, as well as stomach content of the aborted fetus. 4 years old pools or more, we have to taken prepucial wash or scrapings from the prepuce. Laboratory tests for diagnosis of Campylobacteriosis. Number 1, microscopical examination of grams stained smears. Number 2, isolation by culturing. Number 3, agglutination test of vaginal mucus 14 days post-infection. Number 5, test mating heifer for valuable pools in artificial insemination centers. Number 5, PCR for identification of Campylobacter species. Test mating heifer for valuable pools in artificial insemination centers. Heifers 12 to 18 months of age are inseminated with semen to which prepucial wash has been added from suspected bull. Then cultures are made from vaginal discharge of this heifer with application of mucus agglutination test is also applied. Positive results means that this bull is diseased with Campylobacteriosis and have to be culled from the artificial insemination center or the fluke. Negative cultures or negative mucus agglutination test explain that this bull is sound and free from Campylobacteriosis. Campylobacter fetus stained by gram stain under the microscope is appear here as gram-negative bacilli. Campylobacter species grown on blood agar plates. Identification of Campylobacter fetus subspecies by phenotypic differentiation and PCR. Agar gel electrophoresis of PCR products obtained by using of primers pairs Mg3F, Mg4R lanes from 1 to 7 and veins SF and veins R lane from 9 to 15. Lanes 1 and 9 Campylobacter fetus subspecies venerealis 69 up to 05. Lane number 2 and 10 is Campylobacter fetus subspecies venerealis subtype 17 upon 05. Lane 3 and 11 is Campylobacter fetus subspecies fetus 91 up to 05. Lane 4 and 12 is Campylobacter fetus subspecies venerealis 122 up to 05. And 13th negative control, by means lane 13 is a negative control. Number 6, lane number 6 and 14 is Campylobacter fetus subspecies fetus type strain 7. Lane 7 and 15 is Campylobacter fetus subspecies venerealis type strain. Lane 8 is the size marker. This is appear here in this figure. This diagram explains the phylogenetic tree of Campylobacter species. We can see Campylobacter coli, Campylobacter intestinalis subspecies, lonci, Campylobacter hevicalis, Campylobacter avium, Campylobacter jejuni subspecies jejuni, Campylobacter fetus subspecies venerealis. All of them are product to epsilon protectobacteria. And here it by this phylogenetic tree we can summarize where from the infection come from, either from this far or another far, either from our country or from another country. Post-mortem examination. Post-mortem examination shows that show acute metritis, often with decomposing fetuses. Number 2, aborted and stillborn lambs frequently are swollen from the accumulation of sanguineous fluid beneath the skin and between muscles. Number 3, infected lambs that live disecrete or confluent pale foci in the liver. Number 4, fetal placentas are thickened from blood-stained fluids, contain soft gray cotyledons. Number 5, several coalitions, white spots more than 1 cm in diameter were present on one edge of a liver loop. These white spots were not the typical pathognomonic liver lesions one would expect in typical abortion cases. This figure showing a news suffering from abortion due to Campylobacteriosis. This figure of stillborn lambs due to Campylobacteriosis. This is a picture of a liver with several white spots present on one edge of its loop. Differential diagnosis of Campylobacteriosis. Campylobacteriosis have to be differentiated from 7 diseases. Number 1, listeriosis. Number 2, salmonellosis. Number 3, toxoplasmosis. Number 4, leptospirosis. Number 5, oven brucellosis. Number 6, fungal organisms as aspergillus and other mycotoxins. And number 7, infection by Q fever. Treatment of Campylobacteriosis. Treatment of Campylobacteriosis. In case of female cattle, are treated by intrauterine infusion of 1 gram of streptomycin and 300,000 international unit of penicillin in water 3 times per 24 hours. Then washing of vagina with dihydrostreptomycin solution during estrus, followed by mating of poles. In case of male, they are treated by streptomycin injection systematically with combination of local penis infusion 3 times repeated per day. Control of Campylobacteriosis. Control of Campylobacteriosis done through the following steps. Number 1, application of artificial insemination from sound pools. Number 2, detection of the source of the infection and the regular application of mucus agglutination test as a herd test. Number 3, the use of formalin-killed vaccine effectively done in many countries. Number 4, hygienic measures should be taken to prevent water, food, and pasture contamination and the spread of the infection from the aborted materials. Number 5, aborted ewes typically gain good immunity and are unlikely to abort again. Number 6, don't sell ewes from an infected flock from breeding purposes, as some may be carrier animals and they risk transmitting the disease to other properties. Number 7, remove and burn aborted lambs and placental membranes when dying, so please advise farmers to wear gloves and to cover any cuts, abrasions they may have in their hands, as it is zoonotic potential of Campylobacteriosis. Number 8, vaccination is possible through Cooper's Campyvax. Number 9, this vaccine requires native ewes to be vaccinated at least 2 weeks prior to joining the farm, and as a second vaccination when the rams come out from the ewes. Thereafter, ewes should receive an annual posture at least 2 weeks prior to joining. This is the shape of Cooper's Campyvax vaccine. This is the shape of Campylobacter physiogenomi bacterium. Zoonotic potentiality of Campylobacteriosis. Campylobacter is a zoonotic disease. Appropriate hygiene measures must be adhered to this disease. This involves picking up aborted fetuses and their associated materials with gloves, thorough washing of hands with soap and water prior to eating or drinking of anything. Number 4, clothes, shoes, and equipment should also be washed after handling any contaminated material. Number 5, pregnant women and immunocompromised individuals are advised not to be handled any aborted fetuses to be suspected from Campylobacteriosis disease. This is the end of Campylobacteriosis disease, but please keep on the track to following us on this Technical Veterinary Channel to have the most new knowledge and new application of treatment, vaccination, laboratory diagnosis, and different patterns about many of important infectious disease throughout the world.